Porchlight, a presentation of Porchlight VNA and Home Care, providing top-rate, highly specialized and compassionate care to individuals and families in the Berkshires and also in the hill towns of Hampden and Hampshire counties, all in the comfort of their own home. And here in the Berkshires, we are certainly blessed, although we're a relatively small area, to have very specialized physicians who do a terrific job. And one of those physicians is Dr. Eugene Curletti of Berkshire Surgical Associates, who is here. And also with that is the Berkshire Vein Center, which is under the umbrella of Berkshire Surgical Associates. So,
right.
Dr. Curletti, it's a great pleasure having you on the program.
Thank you.
Thanks for coming out. So one of the things that we wanted to highlight here today is that you do an event each and every year, and this year it's on October 30th, where you're going to be really getting the word out about what you do and some of the things that people need to know as it relates specifically to varicose veins. So I want to make sure we get that information out to begin with, and this is something that you do every year.
Yes, we do it actually twice a year. It's a free screening for people who think they might have vein problems or know they have vein problems. And we have two sites, one in Pittsfield and one in Great Barrington, where they can come. It's a free screening, and we evaluate them quickly and assess whether they need to go forward or if they indeed don't have any vein problems. But it's very helpful. It's been very effective, and patients love it.
So we'll mention this again before the end of the program, but it's Wednesday, October 30th at both of your locations, actually. Correct. One in Pittsfield, which is at the Medical Arts Complex in the hospital in Pittsfield, Suite 407 there, beginning at 5 p.m., and then also in your Great Barrington office, which is right off of the main street at the intersection of Route 7 and 23. So we'll get that information out there again before the end of the program. But what I wanted to talk to you about today was sort of the importance of understanding more about varicose veins, because I think for a lot of people it's kind of seen as a cosmetic issue, but that's actually not the case.
No, not at all. As a matter of fact, it's a very common problem that often patients don't bother with or are afraid to bother with because they hear horror stories about the treatment in the past, which is totally changed. But also because they think, well, it's really a cosmetic problem. But indeed it isn't, because untreated, a certain percentage of those patients will go on to very severe skin problems with their lower legs and develop ulcers in later life, which are very difficult to heal. They're not like injuries to the lower legs where the skin itself is normal, but the skin is damaged over having been subjected to the pressures of these varicose veins over years, and so the skin is damaged and they're very difficult to heal when these ulcers occur. They usually occur later in life, after many years.
So tell me a little bit about what varicose veins actually are, because I think we know what they kind of look like, and we'll probably see some pictures here during the program to sort of reinforce that, what they look like. But you know, what causes it and what actually are varicose veins?
Well, varicose, in your legs, you have three major groups of veins, and the purpose of the veins, they are blood vessels that take blood from your lower extremities back to your heart as part of the circulation. The arterial system brings blood throughout the body, and the veins bring it back. It's a continuous cycle. Well, until recently, we didn't realize that all of these veins have little valves in them, and the valves work to keep the blood flowing in the right direction. And the blood needs to flow against gravity because it has to come, especially if we're sitting or standing, from the ground up back to the heart. And so if the valves are working properly, the veins continue to push blood back to the heart. We found recently that since we've had good ultrasound machines that have developed, that we can look inside the veins and see the flow of blood and see the actual valve function. And if the valves begin to leak, and it's usually in the veins that are in the system that is just under the skin, not in the deep veins in the muscle, but in the ones under the skin, the valves start to leak. And if they leak, blood actually starts to run the opposite way, away from the heart. And it pools in the legs, and causes the veins to stretch out, and it's like a vicious cycle. It starts up in the thigh, and then it progresses all the way down to the foot, where all the veins start to stretch out, and they bulge, or they form spider veins. Sometimes you see those on the skin, and they cause symptoms of aching and heavy extremities. Sometimes restless leg syndrome, cramping, especially when people stand or sit for long periods of time. So it's a matter of the blood not circulating properly back to the heart.
And, as far as doing the screenings, I mean, this is not something that's uncommon. I mean, no. Looking at some of the statistics that you have, something like 72% of women after a certain age suffer from varicose veins, and even a high percentage of men as well.
That's true. If approximately 3/4 of women in their 60s will have some varicose vein problem, some venous reflux problem, and up to 40 or 50% of men. So it's actually much more common than the diseases we hear about all the time, which are heart disease and congestive heart failure, stroke, much more common than those diseases. But like I say, people have kind of neglected that for years because for a long time the treatment was difficult. There was a high recurrence rate because we quite didn't understand about this reflux business, and there was a lot of pain and bruising with the procedures, which were, I wouldn't say barbaric, but they were kind of, they had a high morbidity to them, so people would avoid treatment.
So how has that changed over the years, and what are you doing today to
That's changed in that we now know that we don't just treat the varicose vein, which is obvious in your leg. You see this big bulging vein in your leg. In years past, we used to remove that vein by stripping it out or cutting it out. We know that if we just do that and we don't go to the source of the problem, the body will grow new veins and it'll recur. So it's only been since we've had this very good technology of ultrasound that we've been able to really see where the source of the problem is and deal with that first. And until you eliminate what we call reflux, which is the blood traveling the wrong way in the leg, any other treatment that you try is going to fail. So we know now where to start the treatment. And many times patient will, instead of having one procedure that will supposedly take care of all their problems, they may need a combination of therapies that will progressively eliminate the vein problem.
So that would include ultrasound, and then what would some of the other techniques?
The ultrasound would be the diagnostic study, and then under ultrasound guidance, we have techniques where we can actually enter the vein without any incisions, just with a puncture, and we advance a long, thin catheter up to where the first valve is that is not functioning properly, and then applying either radio frequency or laser, we can close that vein up and eliminate blood from flowing backwards in that vein. Once we do that and we eliminate the reflux, many times patients tell me, boy, my legs feel better the next day. What's nice about it is it's an office procedure, and there's no downtime. They can go back to work or back to their normal activities, and they don't get bruising, and they don't have cuts on their legs, and they feel better right away.
That's a pretty dramatic shift from having to go in and cut out veins. I mean, like you said, in a sort of barbaric procedure.
We used to strip them out, put wires in them, and just pull them out. It was very, very kind of crude therapy, actually. But that's all we knew how to do, because we didn't understand about the reflux, because we couldn't see inside the vein to see what was really going on.
That's really remarkable. So the technology has really evolved. I mean, is this in the last 5 years,
or how would you? The last 10 to 15 years.
10, 15 years, okay.
The technology has gotten better and better, and I would say within the last 5 years we've had a real high definition ultrasound that can really depict what the problem is. And then following that, if not all the veins go away, we can treat them with injections of medication, which we mix up with carbon dioxide to make a kind of a foam. and we inject that directly into the veins that may persist after we stop the reflux. And that causes irritation to the lining of the vein, and the vein collapses and goes away. And then the superficial spiders also can be injected with medication to make them go. But we have to go in a sequential way. We have to do the bigger vein reflux problem first, and then the smaller veins sequentially.
And then as far as that goes, you know, how is it for a patient covered with insurance? Because looking at it, you know, perhaps the larger ones may be seen as more of a health issue, and maybe you get to the more of the spider veins, which may be more cosmetic in nature. So do people have to be concerned as far as what is covered?
The insurance will cover ultrasound for diagnosis. Pretty much all insurances cover that. Pretty much all insurances cover the procedure I talked about, which was the venous closure or endovenous ablation, it's called, where we put the catheter up. And then after we've done that, they will approve injections. What many of them will not approve is primary injections for spider veins on the skin, unless you've had one of these other things necessary. I think that's unfortunate, because the spider veins are a manifestation of underlying disease, and left alone can progress, but a lot of insurance companies don't see it that way.
Yeah, well, that's our healthcare system.
Right.
So, but at least it's good that they're
Most
covering.
of it is covered
yeah.
now. Most of it has been recognized. It's been recognized by the insurers that that this is indeed a disease, and not just a cosmetic issue.
Yeah, and just those figures that, you know, where it's the 72 to 75% of women over 60, and it really shows that there are a lot of people out there with this. So individuals that are considering, you know, going to these free screenings, you know, what should they be looking for to understand whether or not they may be a candidate for this on their own legs?
Yeah, well, if you look at the risk factors and the symptoms of venous insufficiency, women are much more common. The problem is much more common in women. It's not clear why that is, but a lot of it has to do with the hormonal changes in the body, or previous pregnancies will do it. But mainly it's people who have aching, cramping in their legs, swelling, particularly swelling, because as the blood pools in your lower legs, some of the fluid leaks out of the vein and ends up in the tissue, so your legs swell. Often you can have this problem without seeing the actual veins. You can have reflux, and the symptoms occur before the veins pop out. So if you have heavy feeling legs, aching, restless legs, and swelling, you may have venous insufficiency before you develop the varicose veins. And the sooner you get that dealt with, the better. Because it's easier to treat and you get a better result.
So, you know, literally before you see it, perhaps you can feel it as well. And then, of course, you know, if you're over 60, sometimes people would think to themselves, well, maybe I'm just getting older, and maybe my legs are getting more sluggish. But this is something not to make hypochondriacs out of people, but to have them think about this, that, you know what, if I'm starting to feel this kind of thing, and then also especially swelling, like you said, without maybe seeing the veins, but that swelling is a red flag.
Absolutely. And the good thing, the nice thing about it is that we can screen these people with a non-invasive type testing. We don't have to inject them with dye or do anything. Ultrasound tells us the story, so it's a very simple, non-invasive way to decide whether someone has the problem or not.
So tell me a little bit about the Berkshire Vein Center, when that began under Berkshire Surgical Associates.
Yes, well, some of us who do vascular surgery always did vein surgery. We primarily concentrated on the arterial system because we could get better results, we could help people more. But I would say in the last 10 years, most of us have become more interested in treating vein problems because they are so much more common, and it's really nice to be able to help someone out who has had a lot of symptoms, and all of a sudden they say, wow, I can walk again. I can
and with the
feel
new technology,
better.
it's you know, so much less invasive.
I think the Vein Center, we developed the Berkshire Vein Center, I would say about 7 years ago now. And it's basically, not all of our group does vascular surgery, but it's those of us who do also now deal with these vein problems. And so we procured the equipment to do the treatments, and we set up our office with a minor procedure room to do the procedures in. So that's another nice thing for patients. They don't have to be admitted to the hospital anymore for vein treatment. It's all done as an outpatient pretty much.
And of course, Porchlight VNA is a Southern Berkshire-based VNA, all historically Lee Regional VNA. But we know that Southern Berkshire is definitely unique in its own way. You have an office in Great Barrington, in addition to one in Pittsfield. So tell me the decision to have those two offices.
Well, Berkshire Surgical has had an office in Great Barrington for many years, probably over 20 years. When Fairview Hospital was going through a kind of a transition time and they needed more help in surgery, we went down, we hired a couple of surgeons in our group to go down and work at Fairview. And they really liked it down there, and so we decided to set up an office down there for them. Fairview's a great hospital, and it really serves that community really well. And so George Vinoglu now has been down there for, I would say, over 20 years, and he does full-service surgery, and including vein surgery. He doesn't do arterial surgery down there, but he does vein surgery. And so it's really nice to have that second office so that patients don't have to even travel up to Pittsfield. They can get treatment locally.
Yeah, and I think that means a lot to the people in Southern Berkshire County. They love their community hospital, Fairview Hospital, which is certainly unique, in this sort of rural
Fine
area.
Hospital, really good hospital.
It is.
But the hospitals in Massachusetts and throughout the country struggle these days to maintain their viability. But Fairview certainly is good at it.
It is, and I know that this community does love it, and they want it indeed. So, looking at that, and then your career, you're from Pittsfield originally.
Right, I'm a native of Pittsfield.
So tell me about your decision to become a physician, and that process as going through your career.
Yeah, I grew up in Pittsfield, and I always was kind of interested in medicine. Right from high school, and then when I went to college at Tufts, I got more interested in it, and I went to medical school in Vermont, and then decided to be a surgeon and went down to Washington, D.C. at George Washington University in my surgical training. But I always liked the Berkshires. It was home. Plus, I always thought Berkshire Medical Center was such a great hospital to practice because it was the kind of combination of community hospital with its roots in the community, but an academic hospital also where residency programs existed. We trained future physicians, and that's what I wanted. I didn't want to be in the pure community hospital. I wanted to be in the teaching role as well. So that's why I came back here and started practice in 1980, and been here ever since.
And I think, perhaps it's a testament also to, again, Berkshire County, as I said before, relatively small area. You could be a physician in many places, but you're from Pittsfield, but also it's a quality of life issue. So I think we're lucky in Berkshire County because our quality of life is, I think, excellent. It probably draws a higher quality of physician.
I think you're absolutely right. I think we've been able to attract very fine, well-trained people here, not only because the hospital is great, but because of the lifestyle in the community. The community offers people what they want as far as education for their children and the beautiful setting, So I think that's that's something we have when in competing with other hospitals, trying to attract physicians, which is difficult these days.
Yeah, it's a tough market out there.
Marketing is tough.
As far as that
And
goes.
recruiting is tough.
So as we have a few minutes left, let's mention again the free screening that they will take place on Wednesday, October 30th, beginning at 5 p.m. at both your offices in Great Barrington and also in Pittsfield at the Medical Arts Complex. If people don't know exactly where that is, it's near the hospital and it's a separate building at 777 North Street. That's actually where your office is.
That's where our offices are. The screening will be right in our office. And the way it goes is that I give a little 10 or 15 minute overview on venous problems and vein problems. And then the rest of us are all there to see patients individually. So every patient will see one of us personally to go over their symptoms and to be examined. And then if anything needs to be scheduled, like an ultrasound, we can schedule it right there for them.
And then how would you suggest that people be prepared to go? I'm sure there's some questions that they may want to have that they're going to want answered and that sort of thing. But how would you suggest someone be prepared to go to the screening?
Well, I think they should have a clear feeling about what their problem is as far as describing it. I think they should think ahead about, okay, this is what I really want to tell the physician about my legs. Whether it's they don't look like I want them to, they swell, they ache, whether it's related to activity or not, whether they get better or if they feel better in the morning, things like that. The other thing is just a simple logistic thing. We ask people if they would wear shorts or something, so it's easier to examine them because we try to see as many patients as we can in that time period, and so it's easier if they don't have to undress and get a gown and so forth. If they just wear shorts. And
October 30th in Berkshire County, shorts could be a little bit of a...
It could be, but
wear your sweatpants over.
You're right.
And you know how it is. Hey, we're in the Berkshires. And also other information about your practice. I know that there's a website and other information.
Yes,
how can people learn more about
BerkshireSurgical.com. There's all kinds of information about vein disease as well as all the other surgical things that we deal with.
Fantastic. Well, Dr. Eugene Curletti, it's a great pleasure having you on the program. Again, it is the day is October 30th. It's a Wednesday, beginning at 5 p.m. at both offices, and I'll just mention those again. The location 777 North Street is the Medical Arts Complex at the offices of Berkshire Surgical Associates and Suite 407. Again, same time, and 475 Main Street in Great Barrington is the other office for Berkshire Surgical Associates, and that's right at the intersection of routes 7 and 23, right near the police station.
Easy to find, right?
Right.
Easy to find.
For people who know that, but you'll have that short 20-minute informational session for people beginning right at 5, and then the screenings will happen thereafter.
We would like, if patients would, to call ahead and schedule a time that they were going to be coming.
So again, the free screening is on Wednesday, October 30th in both offices in Pittsfield and in Great Barrington. And to reserve a time for your screening for both locations, call this number, 445-6422. Again, that number for screenings in both Great Barrington and Pittsfield, to get that slot, 445-6422.
Because then we'll have a better idea of how many are coming in each time slot.
Fantastic.
Right.
Well, Gene Curletti, it's a great pleasure having you on the program, and good luck with the screening. And boy, you have a great practice and a lot of great people who work for you. So thanks a lot.
Thank you very much.
And this has been Porchlight, a presentation of Porchlight VNA. I'm John Krol. Thanks for watching.